So welcome everybody to the Moving Maine learning community. We're excited to have folks here on this Wednesday. And we'll be talking about a pilot in Southern Maine that addresses the affordability gap for people who have basically no income. We know that we all know people who have very little income and folks who have no income, and for them even paying that couple dollars to ride the bus is just not a possibility. So we're excited to hear from Chelsea Hoskins from the city of Portland about a pilot that addresses that. And I think that it provides a good demonstration of what is possible to do with other audiences, and a creative way of using some funds that aren't necessarily transportation funds. So before we jump into that presentation, I wanted to just remind people of what the Moving Maine Network is and does. And so we have as our core strategies that we really want to strengthen the network of folks who are working to improve transportation access across Maine. And one of the ways that we do that is by convening these sessions. We will have a little bit of time for folks to network later in the meeting. So think about if you have updates or questions that you want to pose to the group. We'd love to hear that. Because we have a large enough group that it would take up a lot of our time if we all did introductions. We invite you to introduce yourselves in the chat. So if you want to put into the chat what brings you to this table, whether it's your volunteer role, your professional role, a combination of both, and that'll help with that strengthening of the network. We also work to inform policy change, and we are very actively involved with that right now through the current legislative session, and we'll provide a bit of an update on that as well today. We support better coordination. So at the end of the day, that's what so much of this work is about, is how do we have all the different folks with a stake in better transportation be talking to each other, working together. Our hope is to have mobility management programs exist across Maine, and that's part of the work we're doing, advocacy work we're doing right now. And then finally, we really want to amplify mobility stories. So we want to hear the stories of what mobility barriers look like, how they're impacting people, and also what solutions look like and what can be done there. So again, love to have you put into the chat who you are and what brings you to the table today, and then we'll hopefully get to share out loud a little bit more later. So the other piece that I wanted to mention is that our work here as the learning community is a combination of all three of these pieces. We want to have people share expertise, which we know that every single person here has expertise to share. So we want that to happen during these sessions. We also want to help move people to action on transportation solutions. So there's nothing that I love more than hearing that somebody heard about a solution or met somebody at one of these sessions and was able to follow up and make something happen. And then finally, building relationships. I like to say we're building a relationship infrastructure that enables us to take advantage of opportunities. And one thing I will add before we jump into the presentation is that we are going to, we have received funding through an anonymous donation to the Moving Maine Network that will enable us to have a lot more capacity. So I want to thank you all for bearing with us as we've been through sort of a lean time, but you'll be hearing a lot more from me and other folks working on the Moving Maine Network on how we can do more to help with improving mobility in Maine. And so that is my housekeeping stuff. what I'd love to do now is I'm going to stop screen sharing and I'm going to introduce Chelsea Hoskins, who's with the City of Portland. I will, full disclosure, share that I got to work pretty closely with Chelsea on this initiative, and am just so impressed with the work that Chelsea and her staff have been doing to help folks set up lives here in Maine. And oftentimes these are people who took very long trips, used many different modes of transportation, including their feet, to get here to Maine, to have better, safer lives. And so Chelsea's staff does all sorts of things in addition to transportation. And I had the good fortune of getting to work on addressing some of the transportation barriers with her. And it's a work in progress, but I think that it's very interesting to see what can be done with a relatively, provide people with a lot of access to opportunity through transportation on a relatively small budget. And so lots of lessons learned. And so Chelsea, I'm going to turn it over to you to share and take it from here.
Thank you, Zoe. Okay, I'm not always keen at the screen sharing, so let me try this here. Okay. So thank you so much for having me. My name is Chelsea Hoskins. I'm the program manager for the City of Portland's resettlement program. It is my first time joining this meeting, so I wasn't exactly sure the scope of attendees, but it does look like everyone's very spread out across the state and maybe some of New Hampshire. Some slides I can go into a little bit more detail if there's questions, and Zoe, definitely please cut me off on the time. Sometimes I talk a little much. But yes, this was a really exciting pilot, and I also have some breakdown of just like a little bit more information if we want to get into like what routes or common travel things in the greater Portland area that I was able to kind of analyze after I put together these slides. So I have a background in social services, working in different agencies like Spurwink and Catholic Charities, and then I moved over to the City of Portland in 2017. And my roles at the city have been pretty much exclusively working with asylum seekers. From the General Assistance Office in 2017, we had a city-funded general assistance program that basically helped people who were ineligible at the time for state GA benefits. And then I moved over to the family shelter as program coordinator, and the vast majority, like 95 to 98% of residents there are also asylum seeking families. In 2019, many of you probably heard of the Expo, which we're back in, but we had around 434 to 484 people come through Portland in a 2.5 month period, really, where we provided a lot of sheltering and community support. And then in 2021, the city, in partnership with county CDBG funds, created this resettlement program that I'm working with now. And as Zoe mentioned, we have a team of staff members who support guests who are asylum seekers in overflow hotel sites or shelters that are funded by City of Portland or FEMA funds through the City of Portland, for example. So we're spread out across York County and Cumberland County and different areas and lots of different towns that we'll go into a little bit later. And we help people pretty much with triage case management. So connecting to resources, referrals, providing programming and orientations for new arrivals, such as like being familiar with the area, the culture, learning these bus routes, connecting to different resources, connecting to external providers like healthcare resources, DHHS benefits, understanding expectations of general assistance and the programs that they're eligible for, and connecting as well to immigration supports. So today we're talking about transportation, of course. So there's always been a huge need for transportation access for all populations, clearly. But for asylum seekers in particular, they're ineligible, as Zoe mentioned, for a lot of benefits. So they cannot necessarily work right away. They can't afford bus passes. They cannot necessarily get full benefits through DHHS, or they could purchase them even on things like TANF. So they're really limited to different programs that are giving out these bus passes. So what really kind of was the peak was COVID, no surprise. So a lot of families that were in the family shelter, which is located downtown Portland, you can kind of walk to meet most of your needs. Even if you can't, get a bus pass, most things are walkable, like the hospital and social service agencies you're looking to access. But we had to separate people due to social distancing and health concerns. So they started to be in overflow hotel sites in different towns and municipalities. So those were varied all the way from South Portland, OOB, Auburn, Yarmouth, Freeport, Portland, of course, and Saco hotel site. So there was never a centralized location for individuals to obtain their bus passes, but it became even more of a barrier when you're spread across different locations, and a lot of the services you're trying to reach or access are in the greater Portland area. The numbers were rapidly increasing, so we continued to have these overflow hotel sites for safety and shelter and health concerns. But as they increased, that's how we kept entering into new towns and municipalities. So as you can see, there's different dates and arrivals for family members based on 2021 and 2022, with a real high point around May of 2022. So we were started in Old Orchard Beach, and then we expanded up to Auburn, Freeport, Yarmouth, and every municipality, of course, has different transportation needs and access and what they can offer to this population. So as the numbers increased, service providers were really doing their best to meet the general needs of this population. So they were already stretching their staff, stretching their programming, but what we heard, Zoe, the whole community, everyone at large, was really that transportation was really a challenge for them to meet the daily goals of their program and support these individuals. So on top of the work they're already doing and expanding that work, they're now also having to try to problem solve how to get someone back to their hotel or overflow site that's maybe a few towns away. Are they utilizing taxi passes that are expensive, setting up Uber accounts, communicating with individuals on a WhatsApp platform to make sure they got in their Uber ride, which is staff time consuming, of course, to do that back and forth correspondence with a taxi driver, with the family. So it was really becoming a huge challenge across the board for every agency we talk to. Is really like, this is a big thing that we don't know how to meet the need of. We have people here waiting, they need to get out of our office and get back to their location. And there's not one single thing we can do to resolve this easily. So there are lots of different things that came out of this, and different parts of the states had different options. So for example, Old Orchard Beach, we only had about 20 or so families there. The numbers were a little bit manageable, if you will. So some of the local areas like Biddeford Adult Education came up with a program where they could purchase some reduced fare bus passes for BSUB, train people how to utilize that bus line and access it. And then we also created just a small provider kind of text group. If someone reached out or heard from a family or individual who had an emergency need, we would all blast this group. Someone would likely respond and be able to meet that need for transportation in the moment. But if you had larger numbers or you didn't have that capacity, obviously that's not really easy or reasonable to manage in that type of way. So with partners of many people actually on this call as well, like Zoe and the Bus Ambassadors program, we worked for residents in the Yarmouth and Freeport area to come up with different solutions like a Freeport shuttle. So Yarmouth Community Services, for example, developed their own little bus route on Saturdays that help people connect to different resources and programming. And then the towns together with the county had some funds that they set aside to do a shuttle that allowed people to get into or connect to Breeze lines or Greater Portland Metro lines on Tuesdays and Thursdays. So twice a week, they'd have access to get into town because there wasn't a bus stop nearby at the hotel where they were located at. And with great help from the bus ambassadors to teach them how to use the bus lines and how to use any bus passes, cards, how to transfer, that was very successful for quite a bit of time. However, it still means you're relying on that access only a couple of times a week, for example. So although things were coming together, there were lots of families still residing in large numbers, and a large population was in South Portland who still didn't have one point of contact to get bus passes. Even things like 90-minute bus passes that are paper that you need to get over and over again, our program was able to provide to them. But if we're not there on the weekends or evenings and someone has a need, that still leaves them without. So we began working even more closely with Zoe around public transportation systems and thinking through places like public transportation that already had big programs and going on with places like Maine Medical Center or the school department, and sort of had these processes in place where they could do kind of a carve out contract, if you will, to give so many bus passes at X number of dollars. And so that's something that we tried to pilot, and we're successful in piloting so far after a period of negotiations. But this allowed people to access multiple transit lines. So for those who are placed across different counties and towns, they could now have an unlimited monthly bus pass to access the Zoom and BSUB, for example, in York County, Greater Portland Metro, South Portland Bus Department, and the Breeze that goes up through Freeport and Brunswick, and we had residents still living in Freeport. So that was great because it gave an option to travel no matter where you're located to meet lots of different services. So we worked alongside Zoe and the bus ambassadors. And really every distribution we did, we just tried to provide and connect to the bus ambassador program, who's wonderful and on the call here, to just give an awareness of that and that education of, if you don't know, now you have this resource, but if you don't know how to use it, we're here to tell you and teach you how to access the bus department. So we started this in late 2022. So far in December, we had given out, our first target was the Freeport Hotel because we already had that shuttle running. And we wanted to make sure that people who are getting on that shuttle could also use this card and transfer to other places that they needed. So we had distributed 58 cards, monthly bus passes at that location. Then later in December, 163 at Quality Inn in South Portland, where we had guests residing. February and March, 312 Derigo cards to Motel 6. And then 305 were activated at a Saco Hotel site in March. And then we were looking to do, I don't think we'll sneak it in this month, but at least by May, the new expo building in the city of Portland, where we have overflow of new families for asylum seekers there. Probably around the 200 to 225 people will be distributing in May as well. So some interesting things were the two locations. Of course, those numbers, as you saw, 58 and 163, there weren't a ton of people that we were enrolling compared to the later sites. But we were able to see, based upon the reports, that they were regularly utilizing their bus passes to meet their needs. They maybe didn't utilize this daily, but it was often clear that they were utilizing this weekly to get to appointments, to access different things. Once we enrolled, however, Motel 6 and Saco, that's when we really saw the big ridership increase. So at Freeport and Quality Inn, guests there had already been residing there for about a year. So they've already made some personal connections. They understand the transportation system a little bit better and may have someone that they can call on for personal rides here and there and do not have to access or rely on public transportation. But at Motel 6, those are mostly brand new arrivals. So they have less of those personal connections and are very much tied to and needing the assistance of public transportation to meet their daily needs for their family. So once we enrolled those two locations, we saw a huge increase in ridership, and I'll be curious the next month what the ridership looks like after we get the reports from York County. And they increased kind of like 4.5%, 4.5 times actually, from the initial report that we got from December's ridership to the March one. So some numbers that I was able to also see were the biggest lines of transportation early on. The first two sites was really Quality Inn, connecting from South Portland, getting into Portland was a huge line that was utilized, as well as utilizing a bus line that helped people get to the DHHS building to connect to and apply for different benefits. In January, we saw the same trends. Basically, those were the two top lines of people that access different services for transportation. And then it started to switch a little bit in February, and March, where we started to see the biggest lines that were utilized were those that were being accessed by the individuals at Motel 6. So just reinforcing more so the ridership and who was using it and where they were going. And a lot of that was to access downtown Portland and services like the General Assistance Building that they were connected to and other resources such as that. So the next step will be enrolling the Expo guests, where we're going to continue to see these again are going to be new arrivals. So I'm sure they'll be accessing and utilizing this transportation system pretty consistently. But that doesn't mean that there aren't struggles still. Unfortunately, I'm sorry, I'm out of breath. I'm in my third trimester of my pregnancy here and I'm getting a little winded. But for the challenges that we're still continuing to see is that we can only offer these funds and programs to those who are in our City of Portland Resettlement Program. So that's limited to asylum seekers at certain sites and locations. There are still hundreds more that are in the community that we are not tied to or are not under the City of Portland and are not able to access this program. And of course, as we all know, there are still many people in the greater community who need access to transportation that we aren't able to provide these monthly bus passes to. So although we've met a huge need and we're seeing great access to transportation and ridership, we know at the same time there's a large population that we're still missing and is still in need of the same type of support. And that is it from me.
Thank you, Chelsea. And we will make these slides available after the meeting today. We'd love to get into questions, comments. So I'm going to jump in because I have one thing I wanted to add, and Cindy, we can go to you next. I see your hand is up. One thing that we're looking at with this pilot, and this was, folks who've been talking to me for a few years know how badly I wanted to do a pilot like this in some realm. So we could start to see what does it actually cost when you give people unlimited bus passes. And so in March, it's averaging about $9 per person. So if you were to say what you think it would cost on the face value of a unlimited bus pass at full price would be $60 a month. So that's for local. We'll just talk about local trips. If we were able to get a discount, that would still be $40 a month. By doing this pass program where by doing it at a institutional level, meaning that the city and Metro have an agreement where the city, Chelsea's department, guarantees that they will pay for people to have unlimited rides, that then unlocks a discount through the way that the Southern Maine bus agencies have a setup where they will offer a discount of 2/3 of the cost, which is basically, what they do with the Portland Public Schools. It's what they do with Maine Health. So we're able to do that institutional approach with a new population. And so it could have been that at the end of the day, it cost $15,000 a month with the cap that we had made the arrangement, at least in the short term, which is still far less than what it would cost if we got billed $40 per person. So it's pretty interesting to see that for the people who have these passes, their stress level is reduced. I mean, we haven't done a statistical analysis of that, but the fact that they now know they don't have to keep going back and asking for more passes. They don't have to worry. They know that if they need to use the bus, they have a means to pay for it. And that right now is only costing about $9 per person. So we will be tracking this to see, does that change as time goes on? Does it become more expensive? But even if it, say, went up to $20 per person, that's still far lower than $40 per person. And much lower than the $60, which is what you would have to pay if you walked into the office without any sort of discount. So, you know, as Chelsea noted, there are many other populations that we know also have really no ability to pay. And we know there are lots of social service agencies that are paying. So I think one of my hopes for this is that we can take the learnings from this and start to look at what are other ways, other partnerships or other collaboratives that could put together getting discounts for clients. And, you know, so putting that on the table is that's an upcoming conversation. And I'll stop talking and go to, I see Cindy and then Sarah, and then I think somebody else had put their hand up, but maybe they put it back down. But Cindy, go ahead.
Thank you so much. And this
if
might
you
have
just, and apologies, sorry to interrupt you, but when people talk as a way to just build relationships, if you just want to remind us of who you are.
Sure. So my name is Cindy Yansky. I am a mobility manager in central New Hampshire. We have, I work at a community action program here, and we have 2 bus services that are currently fare free, thanks to COVID. That was one good thing that came from it, but now we're trying to remain fare free. So when I saw this webinar, I thought, let me jump on. So I'm going to get right to the meat of it. And maybe you already mentioned it, but I missed it. What funding streams are you using to fund this particular program?
Yeah, I would love it if we were fare free. We were for a brief time in COVID and then that went away. So for this program in particular, it's how our program is funded, which is through federal FEMA dollars that were brought into the city due to the amount of arrivals we're seeing that are coming straight from the border crossing. So it's, you know, not only limited to our program, but as you've had to have encountered, you know, Customs and Border Patrol on that border crossing to enter the country.
Okay. Okay. Thank you.
Sarah, if you want to go ahead, and then Kate.
Sure. So it's so exciting to hear about this because I feel like, you know, probably lots of us have heard bits and pieces. So thanks so much, Chelsea. It's helpful to hear the details and Zoe, also the financial side of it. Yesterday at the Transportation Committee hearing up at the legislature, the bill that's about increasing public transit funding was one of the ones that was being heard. And I heard a couple legislators, one of whom sounded a little cranky, maybe, and or, you know, maybe less supportive of transit stuff in general, asking presenters questions about this program specifically. And I don't think anyone, I stayed through the whole thing. I think there was a hope that maybe a Metro person would testify or something, and they may have submitted written testimony, but I'm just sorry, this is a long rambling thing to say. If there's some way we could submit, because I don't think they workshop it till next week, this info that Chelsea has, and then also the money data, like that institutional savings data, I do feel like it would be it's like so amazing and impressive. And anyway, if there's any way we could do that, that would be great.
Thank you, Sarah. Kate.
Hi, everybody. I'm Kate Herrick. I'm the Director of Health Disparities at Access at Mead Medical Center and work closely with the Access to Care team. This is wonderful. I love seeing all of this. I'm a little worried from my own perspective that we didn't know so many people received bus passes, and we have been going through bus passes like wildfire and paying for Uber. And I mean, we do Uber for when people can't access the bus. We try to do the bus passes first, but I'm a little concerned that maybe a lot of the people that we've been giving bus passes to probably had a monthly pass. And I guess I want to ask, is there a way to know who? I mean, a lot of times people are so overwhelmed in their lives, their living situations, and don't always know the resources that they have. And I know there was education done by the bus ambassadors, which if I could sing praises for that program and have so much more funding go towards that. So we have more ambassadors. That would be wonderful. But I am really concerned that we may be giving passes to people that already have monthly passes. And what's a way, do you guys have any ways to, I guess, recognize if somebody has that? I know we can't share lists necessarily unless there's releases in place, but I'm really concerned about that we may have been double, like accidentally from both sides doing that. I don't know.
And I think that the challenge has become sometimes people, they were asking for this also for like their family member who's staying somewhere else. We got that question a lot. Can I give this to my brother who's at Oxford Street or something? So obviously they can't, but I think that may happen. It's hard because it's not like, to your point, like a list of names that you can access and check off. But I'd say the easiest thing is if they're at CBI, they're at Motel 6, Saco, or soon, as of next week, the Expo, they 100% will have these monthly bus passes. QI is a little tricky because there's some under Portland, some not under Portland, but if they're under Portland, they will automatically have these bus passes and have had them.
Okay, thanks. I will send out an urgent email right now to the team. Thank you.
And I think that, Kate, I appreciate that you brought that up, because I think that one of the possibilities of doing coordination amongst partners who work with folks who have very low income or no income is that we could coordinate, and we could have, there's an agreement in place that enables, the information to be shared between Metro and the city. So, I mean, one of the things that's really great about it is we can actually look at who's not using a pass and turn that pass off. There's a lot of, so for the, like, really important to keep cash as an option, not saying we go all electronic, but by using what works with an electronic system, it enables us to do more with the dollars we have. So I do think that just that's another plug for how this could work in a sort of perfect world, being able to take, if you're spending $8 a month on 4 passes, or right now they are, there is a discount, so it's 8 passes, but in general, that's $8 that could be spent to have that person have unlimited access. So just something for us all to think about. I know it's slightly different than the like not wanting passes to go out there. I mean, but the other thing is that the way we're having to do it right now, where when you buy those passes as a social service agency, most social service agencies aren't getting a discount. And then it's essentially money. So it's like, once, if that pass gets lost, that's like losing dollars. So there's a lot of, there were a lot of things to get worked out, and I'm not saying it's something that could happen overnight, but there are a lot of benefits to it. Other questions or thoughts that people wanted to share?
Hi, I'm Deb from the Maine Medical Clinics. I have a question for Chelsea. How have the families done with the bus transportation, and in particular newborns and whatnot?
Yeah, I do think that's probably where you're seeing maybe the request for those other alternate types of transportation come into play. Certainly, we have a lot of newborns at the Motel 6 site in particular, and staff on the ground who are there hear often that parents are like concerned about taking their baby on the bus or the convenience, or that's a little bit more challenging to kind of encourage, if you will, right off the bat. But for those with older children or toddlers, it hasn't really seemed to be an issue. I think parents are mostly also right now until it's summer doing a lot of this during the school days, of course. So they're really out and about while the children are at school and engaged. But for those who are newborns and are, kind of still in a car seat situation, that has still been challenging. We'll still get requests all the time, be like, but can you get me a taxi to go to this appointment? It's like, no, we can teach you the bus route. You have your bus pass, you have the options to take your child with you on that type of transportation, unless someone has some sort of extenuating circumstance. And that's when we try to have them re-engage or reach back out to the bus ambassador program. But I think that's like an area or niche of comfortability that still is yet to be explored a little bit more, is really your stroller. How do you access it? Like more of those educational opportunities and or just familiarity with like having your baby with you in those types of locations.
Yeah, thanks, Chelsea. That's been our experience here as well. It's the littles that seems to be an uneasiness about public transportation versus an Uber or a taxi, for sure.
Yeah, and I see Ellen put this in, but there's also the issue if the babies aren't born at Maine Med and they don't have a car seat, the Uber is denying transportation if there's no car seat. So the really only option is bus.
Larry, did you want to make a comment?
Yeah, I'd love to. So, hey all, I'm Larry Days. I'm with BSUB Transit. I'm the new mobility coordinator. So last week we did a little demonstration over at Catholic Charities in Saco with Joanna Testa. We brought a bus over. We had about an hour and a half's worth of time where we took the residents out, mostly new mothers that really had the anxiety around boarding a bus with a stroller. We showed them how to, kind of fold it away once they were on board. We had interpreters there. We showed them how our tablets worked to interpret. We even got some new information about how Catholic Charities uses their interpreters. They have a service that they can call. They answer and they translate quickly for you if our technology is down, which sometimes it is. And we also showed them how to mount bikes on the front. And the week prior, we helped their staff understand basic questions on how to, I'm going from Saco Comfort Inn. I want to go to Market Basket or Walmart. How do they easily show them how to do it without all that anxiety? So we helped their staff with that. We brought the bus over. So we're really kind of diving in and trying to help out the community with everything that we can. So if anybody needs assistance like that, please reach out to me. I can put my information up in the chat feature, and anything we can do to help, we'd really love to. Thank you so much.
Thank you, Larry. That's great. And I think there's really just no substitute for that, like having that opportunity to try it out and see what it's like. And that's, such a valuable experience. I think most people who use transit for the first time do that with somebody they know, so somebody they trust. And so that's great that BSUB is doing that. So I wanted to open it up to other things, that other networking or information sharing that people wanted to bring. And I'm going to lead us off by sharing just a little bit about what's going on with Moving Maine's the bills that we're supporting. And so I would say, so I'm going to share this, and then we're sort of open to sharing information you want to share from your organization, and continue to pose questions to Chelsea, and we'll use the rest of our time in that fashion. So I'm going to share, I know many of you, or if not all of you, have probably received an email from me recently about the legislative advocacy that we're doing. So, and I'm gonna share this document with you in the chat, and then I also wanted to just talk about what's most timely right now. So we have several bills that we're working on. There are numerous that we, that came out of what's called the Policy Action 2023 effort, and that is led by Build Maine and Grow Smart Maine, and Moving Maine joined on as one of the key partners. And so within that suite of bills, we have, there are, 6 bills that have to do with mobility. And so one is about public transportation. And that's the first one on the list here. There are 5 that relate to safer streets. There's also this ADA accessibility for EV charging stations. That's not part of Policy Action 2023, but that's one that Moving Maine is supporting. That's very aligned with our mission. And so yesterday we had 3 bills go to public hearing. And I wanted to give a shout out to Sarah Cushman for being there to provide testimony. I know that others did as well, and thank you for that. So there was a very, it was a pretty interesting afternoon session. You can attend remotely now, so you can listen in on the session just by going to the legislature's website. You can join. If you want to testify, you can request to join by Zoom and be on as Zoom. You can also go in person. So another benefit, another silver lining of COVID is that this is now a possibility, because you may come at 1 o'clock to testify on a bill and it doesn't get heard until like 3 or 4. So it's a lot of time that's needed. But so this public transportation bill that enacted to advance the state's public transit systems by reinvigorating the Public Transit Advisory Council and increasing funding comes at a really important time for our transit agencies. I don't think it's too strong to say that we have a looming fiscal cliff for our agencies. This is something that is being talked about nationally, so Maine is not alone in this happening. And yet I think that what we're talking about as Moving Maine is how do we really have folks understand that sound the alarm that this is happening. It's especially a crisis for our rural providers and those small providers like RTP and YCCAC, who do a lot of what's known as demand response, and they provide a lot of the Maine Care funded rides as well. And so we are, this bill is one of the pieces of how we are advocating for attention and action to be taken to address the challenges. There's more that will be coming in terms of how do we elevate this issue. I think, and I would love to call on Erin to add to that if you have anything to add, but I would just say that we really, I think that we need to think about how we keep our transit agencies going through what is a challenging time, in that there was a big reduction in ridership because of COVID. All the agencies are rebuilding, and we're able to do that with help from rescue funds, which are ending. And there's much more work to do to rebuild ridership, but lower ridership should not be a reason to say that transit's not working, because as preaching to the choir with this group, we know it is an essential service for many, many people. And so there's a major concern that agencies will be forced to make significant cuts if we don't do something soon. So again, this bill is one piece of how we do that. We had the public hearing yesterday. It will be, there'll be a work session scheduled. Maine Department of Transportation is opposing the bill. I think, we're hopeful that through this coalition of people that's come together, that we can make adjustments that would make it feasible to pass the bill. So there's a lot of work going on, and continued support is needed. So though, if you can send a letter, you can still send a letter, you can reach out to your, who represents you in the legislature, and let them know that you support this bill. We will be doing a follow-up with the bullet points on what can be done. So just because the public hearing already happened doesn't mean it's too late to lend your voice to the process. Erin, would you want to add anything to that?
Oh, no, you were pretty succinct on that. I think given the topics for today, if you're, don't know much about how funding works for public transit, the federal and state and the formulas, we can certainly explain all that. But, there's been a conversation for a while now about how much we all love no fares, right? Because the people we work with and the people we represent, that's really impactful. If the state of Maine were to invest in itself in public transit, that would put a lot of us in the position to either get rid of fares or have them a lot lower. But if that doesn't happen, what you're going to see is that our fares are going to go up because we can't afford to operate without recovering some money. And that's just really the sad reality of the vicious cycle of how this works, right? Is that, they're in the committee yesterday, they were saying, well, are the buses full? Well, the data is very clear that the better the service, the more ridership. And when you don't have enough money, you make your service smaller. And so people stop riding because it's not convenient, it's not effective. And there's so much clear data on all of that. And it's always difficult to talk to people who don't understand transportation about transportation. But so if you're not passionate about this, about, funding in general, but you're passionate about the concept of, lower or free fares, then by all means, this is the time to get involved, because if we had more robust budgets, then we could offer a lot more for a lot less.
Thank you, Erin. Well put. So I'll just open it up to any other questions about anything or comments or information that people wanted to share.
So sorry, just to say that I got educated yesterday that we can still submit written testimony even after the hearing. So just to tag on to Erin's comments, like, please submit written testimony, and it can be really simple, like, I support this bill and this is why I care. And maybe we can put the info about the public transit bill in there, but I think they don't go to their work session till maybe next week. So if you could get it in the next, like this week, that would be huge. So just want to put a plug.
Thank you, Sarah. Yeah, and we can send a follow-up to kind of underline what easy, make it easy of what steps are to add in your voice to the process.
And I'm happy to talk anybody through, like, or if you want to run something past, but like anything's good, but just if you need help, please feel free to reach out. I'll put my info in the chat.
Great. Any other questions, comments, info people want to share? Great. Well, I will get us wrapped up for the day. So first of all, thank you so much to Chelsea for joining us today and sharing information. We'll send a follow-up with the recording and the slides, and there will be some information about how to provide how to provide a letter of support for that bill, among others that are in the process. And we would love to hear from you if you have ideas or requests for topics for the learning community. We're open, and we'd love to, we like to have presenters and conversations on issues from all around the state. So don't be shy. And I hope everybody has a great rest of your day. So take care.
Thank you.